Hello, everyone. Thank you so much for joining us here today. It's an honor and a pleasure to be here with Dr. Bill Rivers. Many of you already know Dr. Bill Rivers. If you don't already know him, he is someone who's been a pioneer in our industry, a true leader and advocate across the board in our industry. He's the lead advocate as well for the Association of Language Companies, and someone who really knows language access in and out. And so it's an honor to be able to sit here today, and we're talking specifically today about the recent executive order being revoked, 13166. That was from the year 2000 from President Bill Clinton. And there's been a lot of fear, a lot of uncertainty. This is some crazy times that we're going through, but I think there's a lot of really good news that we're going to be able to focus on. So Bill, thank you so much for being here.
Well, thank you, David. I'm really happy to do this. I'm always happy to talk about the language industry and language access. As you know, I've been in this space in one way or another since 1988, since I was a kid. The language industry is endlessly fascinating to me. It's always dynamic, always changing. And we're going to get stress tested a bit. And as I've said to many people over the last few weeks, we've been through some stuff in the last 5 or 6 years. We went through the first Trump administration, everyone holding their breath, what's going to do to this,
Right.
that, and the other thing. And really nothing much happened, and our industry continued to grow. We went through COVID, and it was initially a heck of a shock, but we pretty quickly pivoted to almost all of our companies already had working virtually, and that wasn't a big deal.
Right.
Do a lot of remote work, and we were able to meet the demand for remote healthcare interpreting pretty much instantaneously. I mean, it was 2 months to get everything scaled up and kind of running smoothly and integrate into telehealth. So President Trump did issue an executive order last Saturday. We're recording this on Friday, March 7th. So on March 1st, he issued an executive order that did two things. It established, declared, decreed, whatever you want to say, English as the official language. And we can talk about that if you want, but that's not really for us, the critical part. The second part was to rescind Executive Order 13166, as you noted, that had been published on August 14th of 2000 by President Bill Clinton. And I think we need to acknowledge that people are scared, people are nervous.
Mm-hmm.
There's been a lot of stuff coming out of DC. There were a series of executive orders around immigration, and we're watching to see if there's a chilling effect of terms of immigrants going into healthcare facilities or going to school meetings and things like that. There are anecdotal reports, but nothing confirmed, of lower attendance rates for immigrant kids at schools. I don't know that we've really seen a big impact of those executive orders on language access in healthcare, for example. But that's still to be determined.
Correct.
And so, you see this executive order is kind of the same. It's in the same theme, it's the same kind of policy strand where, okay, let's declare English as the official language. That is binding only on the executive branch. Executive orders do not create law. They are executive orders. They are to be followed by people in the chain of command, right? It's the president and everybody who works from this, the executive branch, a lot of people. But, I could call it the Gulf of Bill. You could call it the Gulf of David. Nobody has to listen to us.
Right.
And, I'm using that kind of as a tongue-in-cheek example. So in English as the official language binds just the executive branch. But it is meant to be divisive. It is meant to draw a lot of eyeballs, and it is kind of completely redundant. English is the de facto official language of the United States, has been since July 4th, 1776. On the one hand. On the other hand, we have always been diverse, multicultural, multilingual as a nation. And on the other hand, running out of hands here, immigrants come here and they generally try to learn English. If you can't communicate in English, it's very hard to be part of the social and economic fabric of the country. And I think people who come here understand that. And I know we both have recent immigrants in our family backgrounds, in our spouses' backgrounds, and that's part of the American story
Right.
is people come here and learn English. The danger that's posed by the revocation of Executive Order 13166 is not that it's going to eliminate language access, because there have been a lot of really good posts on this by people like Mari Udelman from the National Health Law Program, Bruce Adelson, who's a civil rights litigator here in the DC area, and others that, okay, Title VI is still law. Section 1557, as you said, of the Obamacare Act is still
Right.
law. And so all those factors are still there. Language access is still required. But then is this going to cause it? And it might. We don't know yet. We don't have any really confirmed data on this, but it might cause confusion. It might cause covered entities that want to skate on this, that don't want to invest in it. They may say, okay, well, we don't have to do it anymore. Kind of don't think that's going to happen too often, because any risk or compliance officer will say, hey, wait a minute, it's still the law. Just because one executive order went away doesn't mean it's the law went away.
Correct. And I think that's one of the important pieces for everyone to know that's listening in, is that the executive order, it does not have the power to make the law. We still have Title VI of the Civil Rights Act, as you mentioned, Bill, and Section 1557 of the Affordable Care Act. And the important component, I think, like you and I were touching on earlier today before we jumped on, was this is a kind of a wake up. And I know something like this can really rattle an industry, and it's there's a lot of fear and uncertainty, and it's important to acknowledge that. It's also a real opportunity for us as an industry to pause and stop and say, what is the value of language access? Why should an agency provide language access? And why is that a good business decision for healthcare organizations to provide? What is the negative impact if they don't? And keeping the conversation going there, because there's going to be a lot of things that happen, and who knows, there could be other decisions that are made during this administration that might seem like, gosh, this could have a real negative impact, and it might, but the value is always going to be there. And I think that's not getting enough recognition as to why should language actually be provided in the first place.
Well, so let's take healthcare as a place to start. And there's been 35 years roughly of high quality, peer-reviewed academic medical research that shows that the provision of language access, of quality language access, does all sorts of things. It reduces readmission rates for LEP patients. It improves what in medical terms what's called patient adherence. So following instructions, whether those are discharge instructions or prescription instructions and so on. It reduces malpractice claims. There's a study from the National Health Law Program about 10 years ago that roughly 5% of malpractice claims can be attributed to language access issues. And that's, a couple $2 billion a year. Now, in the context of something that is the largest sector of the U.S. economy, that is $5 or $6 trillion a year worth of spending, that's a very small percentage. It's not a small percentage to the malpractice carriers, and it's a really, a billion here, a billion there, so you got some real money. But when you step back, you say, okay, we step back a little bit. We say, healthcare providers, when they ensure that there's good language access, the patients, on the one hand, have better outcomes, longer, healthier lives, and the healthcare providers make more money because they're spending less money on readmissions,
Right.
and reinfections and malpractice and unnecessary visits and things like that. So in addition to being, morally the right thing to do, being able to communicate with your patient, or if you're in the legal setting, being able to communicate with your client or with the litigants or the witnesses, okay, that's the right thing to do. It makes the provision of that service more efficient and saves money, and boosts the bottom line. And we're waiting for, there's no magic bullet. There's no single study that's going to prove that forever. But in my experience over the last 15, 20 years, there are healthcare providers, that have, the healthcare providers that have really good data architecture, that are smart on tracking their inputs and outputs, as it were, do a pretty good job at saying, okay, this is something we should invest in. You know, as opposed to, oh, we're just doing it for the purpose of compliance and a status.
Right. We have to do it. So I guess
we have to do it. So we're going to check the boxes. We'll find the cheapest provider. We don't really care about the quality, and let the chips fall where they may. Maybe we get investigated or sued, but we'll absorb. That's not necessarily a great way to do business in any in any sphere. But but if you're thoughtful about it and say, okay, there's quality to be had here. There's an investment to be had here, and it improves, the profit, if you will, is, yes, better lives, which we all care about, but it's also, it reduces the spend on healthcare.
Yeah, no, it's so true. And I think that's, again, as an industry, we need to, as we're coming together and right now talking a lot about the revocation of this executive order, we also need to be coming together talking about, hey, what is the value of language access, and we having that strong united voice together, so that the healthcare industry, the clients that are paying for this service, they really understand it should never have been just a box to check, and it moving forward, it shouldn't be, well, now do we still have to, and yes, the good news is, yes, you still have to provide it, and on top of that, it's a really good idea. It's not only is the right thing to do, right, as you mentioned, but there's a real business case there as well. And I think that doesn't get enough attention. And we, as an language services industry, can really help expand that voice and the positive ripple effect that happens when someone is providing consistent and meaningful language access. So the good news, again, for everyone that is fearful, and this shakeup and uncertain times, is, this should not have an impact on language access. This should not have this should not change whether language services is required or not, or provided or not. Like, I think, like, one of the things you mentioned the other day in another conversation I was listening to of yours was that, sometimes with fear, this can create things that maybe certain individuals may not want to go to the doctor as much, or not want to send their children to certain school meetings or things like that, and for fear of, is there something going to happen to me? And so those are real cases, and I think we don't have enough data yet to know how those kind of larger scale situations that are very real, have impacted individuals and immigrants here in this country. But as far as this, go ahead, Bill.
Well, I mean, you take the case of if immigrant patients are avoiding going to the doctor, going to the health center, then they show up when they're really sick in the ER, and it's orders of magnitude more expensive to go through the ER and get treated there than it is to go to a sick visit to your doctor and get a script for the medicine you need. But if you don't, and this is a challenge that we see across the healthcare system, trying to get people into preventive care, trying to get them to do the routine things so that they, and if they have the coverage to do that, which is a separate question, but most everyone does have coverage now, rather than showing up at the ER when it's an emergency. It's called the ER for a reason. And but we have to wait to see the data. Are we really seeing a chilling effect? Because almost everything we have is anecdotal. There have been no confirmed reports of ICE raids at schools or hospitals yet. There's always rumors that turn out to be something else or what have you. And we have to look at our data as the language industry. What do our top lines look like? Are we seeing changes, in billing? We know that some companies that are directly dependent on federal contracting for one or another thing that isn't necessarily related to language access, they're getting beat up pretty hard. But for the companies that are in the the remote language access space or the on-site language access space, what are we seeing? And from what I'm hearing so far is things are pretty much chugging along as they have been. Yeah, there are a lot of nerves out there. There are a lot of there are a lot of and that aren't necessarily related to this executive order, like how is Medicaid and Medicare going to work, right?
Right.
Those are way bigger than the language industry, but they do impact us. But when I think about this executive order, and as much as it's as much agita as it's caused in our space, I'm not sure it's really going to change all that much, other than guidance will be taken down. Maybe it'll be put back up by one or another agency. But as I said, Section 1557 is still the law. The regulations that enforce it, which is 45 CFR 92, which is volume 45 or book 45 of the Federal Code of Federal Regulations, chapter 92. So 45 CFR 92 is still on the books, has force law. Healthcare providers still got to provide language access. This executive order doesn't impinge on that at all.
What's the best way for people to stay informed, and also for people that want to go to the next level and help be more of an advocate and have a larger voice?
So if you're in the language industry, you've got to be part of ALC, in my view. Association of Language Companies. We are on the front lines on this. We pay very close attention. It's not just me as a consultant, but we've got a lot of volunteers working very hard on this. And there's some really good sources out there. NIMSY's been covering this very well and very thoughtfully. I've done a couple of live streams for them. They've had some other folks on. If you're looking at the broader language access picture, places like the National Health Law Program and the National Immigration Law Center are also doing really good work and staying on top of this and giving factual information, very careful readings of the laws and of the executive orders, and no hype, no panic, but let's just deal with the world as it is.
Yeah, no, thanks for mentioning that. It's important in our industry, whether you're a healthcare provider, an interpreter, or even an agency, a language service agency, like you mentioned, to be involved and make sure that we together as the language services industry can help move the needle forward. And there's so much more we can do together to really show the world the value there for why language services should not just ever be a box that's you're either supposed to check, or maybe you're now I'm not supposed to check, and the real value there.
Yeah, I mean, one of the things that sometimes gets lost when we talk about language access, and what does a language services company provide? Well, we provide the linguists for the interpreting of the translation, right? We also make sure they're qualified. We also do a lot of work in helping covered entities with compliance in terms of data collection and reporting, and we take a lot of that burden on, and we've been doing it for 25 years with this executive order, but really for much longer in terms of healthcare language access, and that's not going away. I mean, it's 26 million people, according to the census, are limited English proficient, speak another language at home, and speak English less than very well. And the census just asks you speak very well, or not well.
Mm-hmm.
And if you say well or not well, then you're considered limited English proficient. But then there's like another 49, almost 50 million who speak a language other than English at home, who say they speak English well, but might need an interpreter when they go to that, oncology consult. Might need an interpreter because now they're like my in-laws, they're elderly, and I'm probably the only person they speak English to. And, they didn't need interpreters when they were working professionals 40 years ago in Los Angeles, but now they do need interpreters when they go to the doctor, to the health center. They're not counted as LEP. And so the actual demand is sometimes, I think the census kind of masks what the actual demand is, and that you'll see in the press with 350 languages, that's a census number. I have a colleague in New York City, wrote a book called Language City. He found more than 800 languages in New York in 2023.
Wow. 800 in New York.
800 in New York City alone, not New York Metro, just New York City. We're one of the most linguistically, culturally diverse places in the world. We had a plumber come in. He speaks a language that's of the Mizoram province, and there are like 1,000 people in the U.S. who speak it. You know.
Yeah.
Mizoram is in India, but sandwiched between Bangladesh and Myanmar. It's like, you know, and like I kind of knew where it was, didn't know the languages. You know? So it's like I don't know all 7,000 languages yet, but you know, and to me, you know, as a linguist, as a language nut, I find that really cool, and you know, good for him. He's here. He's running a plumbing company. I'm kind of glad I don't have to find language access for him. I'm not in that space anymore where I used to do a lot of that. Like, hey, we need a Bravanese speaker in Des Moines. I'm like, Bravanese? Yeah, we don't know where it's from either. So, okay, that helps.
Yeah, give me a minute.
I found that one. I was able to do that. But you know, and you know what this is like. The linguistic diversity is so you know, it's so immense and so complex here. And this executive order isn't going to change that. You know, president can take his chair down to the edge of the sea and tell the tide not to turn. Okay.
Yeah.
But you're still going to have people here who need language access. And it's our industry provides that. And that's still required. And
that's the good news. And again, hopefully as an industry, this just makes us stronger, right? We can really see this as, not to sound cheesy, but to see this as an opportunity, right? Yeah. Where it brings us closer together, and because it should never just be about, oh, do I have to provide it, or now do I not have to provide it? It's got to be bigger than that, because again, there could be other things that come up here in this administration or beyond, and it's important that we're seeing it beyond just an executive order.
But yeah, this language access is here to stay. The industry, you know, we're in a place where, again, there are lots of challenges. I could spend the next 2 hours talking about AI, and I've done that on other podcasts. I do encourage people to stay involved and to pay attention to what the ALC does, what the Safe AI Task Force does. It's just Safe AI TF all squashed together .org. There's going to be a hearing of the U.S. Commission on Civil Rights on language access on March 21st that I'll be testifying at, and we'll share that with the ALC so they can watch the live stream and such. But it's also important to there are a lot of people working on this, and we had a organizing meeting of the Language Access Consortium on Monday, and there were 70 different organizations that are taking on one or another piece of saying, well, hey, here's this executive order, and what do we do about it? Part of it is reminding the client side, reminding the population, reminding the LEP, individuals and residents and citizens that, hey, language access is here. It's here to stay, and it matters. So,
hopefully that gives us some hope here, more hope going into the weekend, and just also encourages everyone to stay involved or get involved if you're not already. And Bill, you gave some great options there.
Yeah, and if you're an individual linguist, get involved with your professional society. You know, with your local chapter of ATA, with CCHI, with ATA itself. You know, get involved.
Yeah, and CIHC is another great one. So,
yep.
Well, thank you so much, Bill. Appreciate your time.
My pleasure. Thanks.
And everything you're doing for our industry. Thank you.
Right. Bye.